Our plan will provide the COVID-19 vaccine to DOD uniformed service members, both active and selective reserve components, including members of the National Guard, dependents, retirees, civilian employees, and select DOD contract personnel as authorized in accordance with DOD policy on this topic. So on that question, I think as General Place indicated, at this time, DOD is expected to receive just under 44,000 doses of the Pfizer vaccine as early as next week for immediate use. DOD's plan for distributing this vaccine includes monitoring processes to inform senior leader decisions about distribution capacity, increased distribution at administration locations, and our force health protection.
Between all those locations are people.
The department will prioritize DOD personnel to receive the vaccine based on the CDC guidance and on the department's own COVID task force assessment of unique mission requirements. The DOD prioritization plan is consistent with CDC guidance and prioritizes healthcare providers and support personnel, residents and staff of DOD long-term care facilities, other essential workers, and high-risk beneficiaries to receive the vaccine before other members of the healthy DOD population.
Our country and our forces should be assured that the risk of this or these vaccines, from what we know, is much less than the risk of the actual disease process. So our advice to everyone, on a volunteer basis, our advice to everyone is to take the vaccine, just based on risk.
As our way to pilot and validate. We do intend, as part of this initial phase of healthcare workers, emergency responders, et cetera, have some very small set of very visible senior leaders that will volunteer to take the vaccine, do it in a public way as one way of helping to message the safety and efficacy and encourage and underscore that we're encouraging all those eligible personnel to take the vaccine.
Categories for deploying units for senior
the department leadership, but also the service leadership and then the combatant commands in a way so that we can get that message out to as large a population as possible, because each of those have their own lines of communication and they have, many of them are set up, volunteered already.